Good afternoon, everyone. My name is Dr. Kevin Pinkos, and I'm an orthopedic surgeon here at OrthoVirginia. I want to welcome you to this Facebook Live that'll be focused on robotic-assisted knee replacements and, generally speaking, knee arthritis. Thank you to our team that has put together this program for you this afternoon. There's a lot of work that goes on behind the scenes, and so I'm really appreciative to our staff that has helped us set it up. So here's an overview of what I plan to cover this afternoon. We'll go through a PowerPoint maybe over the course of the next 20 minutes or so, and then leave an opportunity for your questions. I'll give a brief overview about arthritis and non-operative treatment options, when to start thinking about surgery for knee replacements, and then get into some specifics about why robotic-assisted joint replacement surgery can be particularly beneficial to you as a patient for your recovery, overall recovery expectations, and then that Q&A session there at the end. This is a little bit about me and my practice. I grew up in Philadelphia, Pennsylvania, went to both undergrad and medical school in that region, and then about a month after September 11th occurred, I joined the Navy, and that's what ended up bringing me to this area of Hampton Roads. I'm speaking to you live from our office in Chesapeake, Virginia. We also have an office in Virginia Beach, and so that's what brought me here to the Hampton Roads region. I've now lived here for over 13 years combined, having spent some time on active duty in the Navy, and I've been here, then moved away and came back. You can see my orthopedic surgery training was completed in the Navy, so initially at the National Naval Medical Center in Bethesda, which is in outside DC. And then I spent some time as a flight surgeon with a F-18 squadron, and then did my residency here in Naval Medical Center Portsmouth, fellowship training in joint replacements in Boston, and as I said before, spent 16 years on active duty in the Navy, which I finished 3 years ago, and I remain a reservist to this day. So I'm board certified and fellowship trained in joint replacement surgery, which I think is really important for those of you that are thinking about having a joint replacement completed. You want to make sure that the person has the right training and background to do it well. But this is really who I am. I'm a dad and husband and military service member, a weekend warrior athlete, nights and weekends, just like many of you. And so this is really touches on what I enjoy doing in my off time outside of work. So your joints are involved in almost every activity you do. And until you have an injury, you sometimes don't realize how much you use a particular part of your body. But an arthritic or diseased knee or hip can really limit your ability to move, to work, and it really starts to affect your quality of life. What I commonly hear from people on an everyday basis is, I can't do the things that I enjoy doing that I used to, and it's keeping me up at night or impacting my sleep, and that really impacts people's mental and physical well-being. Arthritis is a very common degenerative disorder that's caused by a degeneration of the cartilage and affects over 25% of adult population in the US. The symptoms consist of pain, swelling, and stiffness. And as the cartilage is worn away, eventually it begins to rub bone on bone. Arthritis is increasing as our population ages and grows. And you can see that chart on the left that there's a steady increase as time goes on in the amount of arthritis that is projected to affect our population. As far as causes for arthritis, age is a factor. Things that have happened in your life, such as trauma or prior injuries. Genetics can play a role in the development of arthritis. But oftentimes I tell people it's just, unfortunately, the cards that you have been dealt. It's not necessarily something that you did or didn't do in your life. And you don't necessarily have much control over the development of that arthritis. We're talking mostly about osteoarthritis, which is the most common form of arthritis. However, there are other forms of arthritis to include rheumatoid arthritis or gout and other sort of inflammatory arthropathies. Can it be cured? Well, not currently, unfortunately, in 2024. There are many research endeavors that are being completed. However, right now there is no cure for arthritis. It's all about trying to control the symptoms. So how do we relieve knee and/or hip pain without surgery? I always encourage folks to use surgery as a last resort. And there are a number of non-operative treatments that should be tried before you resort to an operation. So the first listed there are activity modifications. And this really includes going from high-impact activities to lower-impact activities. Slide, please. So this is me running triathlon, and I found that used to really impact the running portion of it, would impact my joints. And so therefore I moved on to more cycling activities, which is lower impact on your joints. And so that's a good kind of example of what activity modifications are. So really trying to change the type of things that you do in order to put less strain on your joints. Other treatment options, non-operative, include medications, preferably non-narcotic pain relievers like Tylenol, acetaminophen, or non-steroidal anti-inflammatories, NSAIDs. That includes things like ibuprofen or naproxen or other prescription non-narcotic pain relievers. Injections are something we can do right here in the office. That includes cortisone injections or something called hyaluronic acid injections. Those are viscosupplementation injections. The type of exercise that you do, low impact exercise is preferred, but trying to remain active is really important for folks with arthritis. And we find that those that are more active tend to do better than those that are more sedentary with arthritis. Weight loss can be helpful for putting less strain on the joints. Physical therapy to help strengthen the quadriceps muscle is important. Either a home exercise program or formal physical therapy. And then there are some braces that we can utilize to help offload the joint and impact arthritis. And then there are some alternative or biologic therapies that people will ask us about, including stem cell or PRP injections. And those are useful conversations to have in our office. Again, non-surgical treatment options include, using a cane or a walking stick, walkers if you're having difficulty with balance. Applying heat or ice therapy can help relieve pain around an achy joint. I mentioned physical therapy and strengthening the muscles around the joint in order to help offload it. And again, our go-to medications for treatment of arthritis are Tylenol and NSAIDs, prescription strength ones. Well, when is the time right for joint replacement? Well, number one, you have to have bone-on-bone arthritis of the joint, and that's done on an X-ray. So when you come into our office, we'll evaluate the joint, we'll perform a physical exam, and of course, we'll get X-rays. Most times, MRIs are not needed to diagnose arthritis. The second requirement to be eligible for joint replacement surgery includes having daily activity-limiting pain, which is impacting your functional activities, the things that you do on an everyday basis, or those things that you desire to continue doing recreationally. And then you have to at least have tried and exhausted non-operative treatments, which include medications, injections, physical therapy, those things that I just listed. And so when all else fails is when joint replacement may become a good option for you. These are some questions to ask yourself about whether or not you're ready for a joint replacement. Is it impacting your ability to get a good night's rest? When we find that the inflammation that's associated with arthritis of a joint is keeping someone up at night, that is often a good sign that their arthritis is progressing. Does the joint pain keep you from doing those things that you enjoy doing with your family members? Have you become less active simply because of joint pain? Like, I'm not going to go and do something with my spouse because I know that I'm going to pay the price for that. My joint will hurt too much. And is the joint pain affecting your ability to get around your house, get up and down your stairs? Those are times when people start considering joint replacement surgery. So now we'll move into the surgical treatment and total knee replacement and how it works. the x-ray over on the left shows a knee that does not have bone-on-bone arthritis. The one in the center, you see that their cartilage has been completely degenerated such that the patient then has bone-on-bone arthritis. And the x-ray on the right is after a joint replacement. There are both partial and full knee replacements. About 15 to 20% of patients may be eligible for a partial knee replacement, and that's the x-ray that you see on the left-hand side of your screen. That in particular is the medial unicompartmental knee arthroplasty, partial knee replacement of just the inboard side of the knee, as compared to on the right side of your screen, you see a full knee replacement. There are different alignment abnormalities when it comes to people with advanced arthritis. On the left side here, you see relatively neutral or normal alignment. As arthritis progresses in some patterns, people become a little bit more bow-legged, and that is called varus alignment. And alternatively, over on the right side, some folks tend to become more knock-kneed, and that's called valgus alignment. And so as arthritis becomes more significant, you may notice these changes in the way that you walk or the way that your legs look in the mirror. Those alignment abnormalities can be corrected during the course of a joint replacement. And so this is an example of a person who had pretty significant varus alignment or bow-leggedness. And so the x-ray shows before the operation where that line that is dropped from the hip to the ankle falls well to the inside of the knee joint. Whereas after the joint replacement, you can see that the legs are much more normally aligned. This is a different type of example where a patient is valgus alignment with knock-kneed deformity. And then this is what that patient looks like after the surgery. One more before the surgery. And then here is after, where you can see that knock-kneed alignment has been corrected. So that's a very impactful thing that people often will notice after their joint replacement, that their alignment has changed. So moving on to specific about robotic-assisted knee replacement surgery. So this is one of the tools of modern-day knee replacement that allows us to do less dissection, to make very accurate planning and sizing for the implants. And so I wanted to talk a little bit now about robotic-assisted knee replacement. The picture here shows what the robot actually looks like. It's about 5 feet tall, and you can see that there is a saw on the end of this arm, which is what allows us to make these very precise cuts. So I'm going to begin by holding up a model here of what a knee replacement looks like. And so a knee replacement consists of metal and plastic and titanium. And so when we're doing knee replacement surgery, it's essentially like carpentry or woodworking. And we are removing the surfaces of the bone where the cartilage has worn away and has now rubbed bone on bone. And we're surfacing the end of it in order to decrease pain and improve people's symptoms. So that process of knee replacement surgery essentially involves making these very precise cuts at the end of the femur and across the top of the shin bone, the tibia. And once we make these cuts, then we insert a titanium base plate into the top of the shin bone or tibia, and then we insert a cobalt chrome onto the end of the femur here. So this is how this goes on to the ends of the bone, and then this polyethylene liner, plastic liner snaps in between those two metal components. And then most times we shave off the bottom of someone's kneecap and we resurface the bottom of the kneecap, which has also become arthritic in a lot of cases, and replace it with a polyethylene button. And so that's what becomes your knee replacement. So how we make those precise cuts at the end of the bone is really where robotics comes into modern day knee replacement. And we used to do those surgeries with more standard instrumentation, and that has really been a migration that has happened particularly over the last say 8 to 10 years. So as part of the robotic-assisted surgery, we typically would get a CAT scan in advance of the operation. A CAT scan is essentially a 3D X-ray that allows us to map the patient's particular anatomy so that we can really perfectly size the implants to that patient's anatomy. So this is what we see in the operating room. It is a overlay of the planned implant, which you see in blue, over the top of the CAT scan that you have obtained preoperatively. You can see over on the right-hand side of that screen, it shows sizing. So for this femur, 4, and the tibia 5, and then the polyethylene in between, a 9. So we really know the patient's implant sizes oftentimes before we've ever made an incision. This is a balancing tool that we do in the operating room that allows us to make sure that we get the flexion and extension gaps really perfectly corrected. And so we can see in this particular patient who had valgus alignment, that's the knock-knee deformity, 3 degrees of valgus, and it allows us to put some objective measurements to these things and make sure that we really dial in their post-operative alignment even before we've made any sort of cut. This is another view of intraoperative balancing. And again, all of these manipulations are being done before we actually do the carpentry work to remove the cartilage surfaces from the end of the bone. And it allows it to be very precise and, again, do less dissection really than we once did for this type of operation. Here's a little bit about recovery timeline after a total knee replacement. So the surgery can typically be done either as an outpatient or stay overnight in the hospital. The vast majority of patients go home within about 24 hours of the surgery. And so in the first couple of weeks after the operation, I call it the "why did I do this" phase. And so it's very common for people to, certainly develop a fair amount of swelling, inflammation, and pain. And our goals really in the first few weeks after the operation are to try and decrease that swelling and inflammation and decrease pain. Oftentimes people are using a walker in the first few days or up to a week or two, and then transitioning over to a cane. By about 4 to 6 weeks after surgery, people are oftentimes starting to feel a lot better. The swelling and inflammation has gone down. Most people can drive within about 2 to 3 weeks of the operation. It does depend on whether you've had a left knee replacement versus a right knee replacement. And there are some other factors there, but the vast majority of people are able to drive by 2 to 3 weeks after surgery. There is a gradual return of strength and endurance over the course of the next few months. I would say that most patients by about 2 to 3 months after the operation are feeling happy that they had the surgery done. And then that can continue to improve for really a full year after the operation. And so by 12 to 15 months post-op from a knee replacement, that's usually what people are going to feel like long-term. And so it's important to keep in mind that this is not necessarily a surgery that, has immediate recovery. The first 6 weeks are the hardest. The second 6 weeks are easier than the first, and people can continue to make improvements for really a full year after knee replacement surgery. That's all the prepared comments that I have. I'll be happy to take your questions. And thanks again for coming to join us.
Thank you so much. We do have some questions coming in, and please continue to leave your questions in chat. We will be answering a mix of questions that were submitted earlier and questions that were submitted live. We will answer as many questions as we have time to answer, but unfortunately, we will not be able to answer all of them. Our first question is there an age cutoff?
No, there isn't. So, generally speaking, the requirements to have a joint replacement are that you have the right x-ray that has bone-on-bone arthritis, that you have daily activity limiting pain, and that you've at least trialed the non-operative treatments for it. Joint replacements are expendable parts, a little bit like the tires on your car. And so you really want to have one joint replacement in your life if possible. And so oftentimes, I'm often, discussing with younger patients in particular, trying to hold off on joint replacement as long as they possibly can. So, I tend to be a little bit more conservative on the younger side of having joint replacement, as opposed to, a lot of folks are living longer, healthier lives these days. And so, we regularly do knee replacement surgery on folks in their 7th, 8th, or even 9th decade of life. And so there is not an age restriction. Most often it has to do with, what other kind of medical issues do you have or challenges that you have? And it's really about your physiologic age as opposed to your chronologic age.
Thank you. Is recovery time different between a traditional knee replacement and a robotic-assisted knee replacement?
Yeah, that's a good question. So I think that, just generally speaking, our recovery has gotten better as time has gone on. I wouldn't necessarily say that's just about the robotic-assisted knee replacement, although that may be a factor in it. But kind of anesthesia protocols that we use to help multimodal pain control around the time of surgery are really key. So, not just using narcotic pain relievers after the operation, using some of these non-narcotic pain relievers and adjunctive medications that we can use to help speed someone's recovery. There are some additional modalities that we use after surgery to include, compressive ice wraps and exercise bike, a stationary bike that can help to kind of move people's recovery along. Robotic-assisted knee replacement does allow us to do a little bit less dissection than we had done traditionally, particularly in those cases of larger deformity. And so overall, the recovery from knee replacement is faster than it once was years ago. When I was initially in my training, a lot of people were in the hospital for 2, 3, 4, 5 days after a joint replacement. And now the vast majority of patients are going home, as I said, within 1 to 2 days most commonly.
Thank you. How soon after one knee replacement can you have a knee replacement on the other leg?
So I typically say a minimum of 6 to 8 weeks. You really want to have kind of progressed your recovery from one side and be happy with it before you move on to doing the other side. 6 to 8 weeks is kind of, my minimum. The vast majority of patients, it tends to be somewhere in the range of 3 to 6 months because they're, want to get that joint that has been replaced kind of back to feeling as best as possible before they move on to the other side.
Thank you. What do the scar or scars look like after a robotic-assisted knee replacement? And are stitches used?
That's very dependent on each individual surgeon. For me, the scar is about the length of my hand, and it goes down just kind of the center side of the knee. I personally use an all-absorbable closure that has no stitches or staples to be removed. All of the stitches are underneath the skin, and then we have a skin glue with a special dressing that goes over the top of it, so nothing that needs to be removed. The vast majority, this is kind of a plastic surgery style closure, so designed to really give a good cosmetic appearance after fully healed.
Thank you. If someone has screws from an ACL repair, do the screws need, or anything else, do the screws need to be removed before a knee replacement?
Great question. So this is really, as I moved to robotic-assisted knee replacement over the past few years, this is one of the factors that has really been impressive for me. So the answer to your question is it depends on the location of the screws, but for standard ACL reconstruction, most times we don't run into the screw that's on the femur on the top side of it. We often will see the screw on the bottom portion in the tibia. But by having the CAT scan and doing the robotic-assisted surgery, oftentimes we can maybe change the location of the implant a little bit before we've made any cuts to try and avoid some of that hardware. And so this is a clear advantage for me, having gone to this robotic-assisted surgery over the last few years, that allows me to maybe leave some hardware that didn't necessarily in the past would have needed to be removed.
Thank you. How long is the surgery itself? And is the time different with a robotic-assisted surgery versus a traditional surgery?
Just generally speaking, the surgery itself is highly dependent on the surgeon that's performing it. For me, it's about 90 minutes to do the actual operating. Now, oftentimes folks are in the operating room longer than that because of the anesthesia preparations that are made, positioning, prepping, draping, all of the things that go along with it. But the actual surgery itself typically takes less than 90 minutes. As far as that being different with traditional knee replacements versus robotic-assisted, for me, it's essentially time neutral. So I think earlier on, when people are just getting used to this technology, sometimes it can take a little bit longer. But as surgeons increase their volume with the procedure, then it, for me, actually became a little bit faster.
Thank you. Are the nerves around the knee affected by a knee replacement?
Yes. So there is commonly an area of numbness that will occur to the lateral side of the incision with a knee replacement incision. That's because there's a sensory nerve that comes across the front of the knee that's less than the diameter of a hair. It's not something that can be saved or preserved during the operation. So oftentimes, I tell our patients that they can expect to be numb in an area about the size of a baseball towards the top and lateral side of their incision. And over the course of the first year, sometimes that area will shrink in size, usually ends up about the size of a $50. But that is kind of a permanent area where they won't be able to necessarily feel it. Now, that for most patients is not a big deal. There are two types of things that nerves can do. They can either go numb and, you can't feel or sense that area, or they can cause other symptoms of, for example, a burning or tingling sensation. And so we would much rather they be numb, just can't feel it, as opposed to the latter where it bothers people. But fortunately, in the vast majority of knee replacement surgery, that ends up becoming less of an issue for the majority of patients.
After a total knee replacement, when can someone return to exercising in a pool?
I typically recommend waiting at least 6 weeks after joint replacement surgery before submersing the incision. We want to make sure that the skin has fully healed over the top of it. There's no signs of any sort of wound healing issues or things like that before you would submerge it into a pool. And so for my typical patients, we're seeing you back in the office at 2 weeks after the operation, and then again at 6 weeks. And once I've seen them for that 6-week postoperative appointment, we're usually clearing folks to return to submersing it in a pool or hot tub or bathtub.
How long does the knee replacement itself last? And does the knee replacement last a longer time or shorter time, depending on the activities that somebody does with it?
Yeah, so generally speaking, knee replacements fail at a rate a little less than 1% per year. And so what that means is there can be an early issue after a knee replacement, such as, an infection or wound problem or loosening of the components from the bone. And there's like kind of this early bump early after surgery in the first couple of years. But then once a knee replacement is tracking along okay, then the chances that it would last greater than 20 years with modern day knee replacement surgery that's executed well and rehabbed well is well upwards of 90%.
Thank you. Is the ACL removed in a total knee replacement?
Yes. So there are different types or styles of knee replacement, and the ACL is almost always removed. There are different types where the PCL or posterior cruciate ligament is retained. A little bit of that has to do with the type of arthritis that the patient has, how significant the deformity is before the operation, and it's not necessarily a one-size-fits-all thing. So, having your surgeon make a determination as to which type of knee replacement is best suited to you is important.
How soon after a total knee replacement can someone do steps?
Well, right away, before we have folks discharged home from the operation, they have to demonstrate to us that they can safely navigate stairs. And so most times, it's on the day of or the day after the operation where they're working with our team, physical therapy folks, and understanding how to safely do stairs. Now, again, after having a major surgery like knee replacement, folks are not going to be running up and down their staircases multiple times in a day. And so, but you do have to be able to do the stairs in order to be able to go home.
Is there usually a leg length change?
Not typically with knee replacement surgery. So anything that's removed as part of the operation is replaced with the knee replacement components themselves. Now, the plastic insert between the two metal, this plastic insert can vary in size, but it's by millimeters. And so I will tell you that fluctuation in the size of that insert has, for me, over the course of time using robotic-assisted surgery, become quite narrow. So, the changes that we used to see of, several millimeters have now gotten much smaller with more precise robotic-assisted surgery. But most people will not notice a leg length change or inequality after knee replacement surgery. When people have hip replacements, that is something that they more commonly do notice, changes in their leg length, but it's just not quite as common with knee replacements.
Can a robotic system be involved in the surgery to replace an existing partial knee replacement with a total knee replacement?
Yes, this is a real advantage of using robotic-assisted surgery is converting a prior partial knee replacement to a full knee replacement. In the past, that is been a more challenging operation when done with traditional instrumentation, but the answer to your question is yes, you can use robotic-assisted surgery to convert a former partial knee replacement to a total.
Are all knee replacement implants the same? If they're not, what factors does the surgeon consider for an individual patient?
No, not all knee replacements are the same. So just like brands of cars, there are many different manufacturers on the market. And what type of implants are used has a lot of factors, but mostly comes down to surgeons' training and preferences. And for example, which things are available to use in this case with robotic-assisted surgery. So not all implant companies have an implant that can be utilized with robot-assisted surgery. And, I think for me, one of the biggest factors is track record. And so we have databases of joint replacements from around the world, and some have a better track record than others. And so we look at registry data from not just joint replacements that have been done in the United States, but in other countries throughout the world, and really focus in, for me, on those that have a tremendous track record.
If one knee was replaced with a more standard traditional surgery, would surgery on the other knee be a candidate for robotic-assisted? Would the other knee be a candidate for robotic-assisted surgery?
Yes. I mean, obviously, each individual has to have that evaluation, but what was done on the other side for their knee replacement does not necessarily impact the ability to have a robot-assisted surgery on the side that's impacted. So, yes, it should be able to do that.
How many knee surgeries should a doctor perform a year to remain proficient? And what are the continuing education requirements?
There are some studies out there that show that it's not just about the surgeon and how many surgeries that person is performing, but also the hospital in which it's being performed. So I think, generally speaking, at least 50 knee replacements per year per surgeon, and several hundred per year for the hospital or surgery center where it is being performed. Because it's not just about the surgeon. This is a team effort and involves many different folks, from the anesthesia team to the surgical team, techs. So many people are involved in the care for joint replacement surgery, and you really want the whole team gelling and working well together. Great question.
Thank you so much. That is all the time we have for questions today. If you would like to make an appointment, please visit orthovirginia.com. Dr. Pinkos, would you like to close?
Yes, Margaret. I just want to thank everybody again for coming to join us. Really enjoyed this venue and having the opportunity to present on robotic-assisted knee replacement and take your questions. So I hope you enjoyed it. Have a great day.